Hi folks, this is Hariom for CBNR. Uh, Welcome to a new edition of a series of videos on how to critically evaluate newer techniques for scientific merit. This is the first of the series, and in this video I'm going to talk about how to evaluate newer techniques in neurology, neurorehabilitation, right? Uh, Remember, there are only two types of physiotherapy. One is active, another one is passive. What I mean by active is treatment techniques which allows or makes the patient do things. And in passive, what I mean by passive techniques are where you are doing something, that is the physiotherapist is doing something to the patient, like passive movement, passive stretching and things like that, right? So the first thing we want to understand in any UMN lesion, right, in any neurorehabilitation or even in a peripheral lesion, most of it is towards improving movement, right? Um, Whether it is functional movement or task movement, right? So movement is what we are majorly concerned about. If we are concerned about movement, right, whether it is peripheral nerve lesion or a human lesion like Parkinson's, uh, stroke, post-stroke patients, or cerebral lesions and things like that, everything is about movements. And remember, movements are produced by the brain, right? It cannot be produced by anything else. So if it is produced by the brain, you cannot do anything else except for teach your patient to do that movement, right? So teaching by definition means that the patient is learning, and if he has to learn, he has to do it again and again, and it also has to be active, right? So when somebody is telling you, okay, this is a new treatment technique, this produces this effect, that effect, right? The first thing you want to ask is this active or passive, right? Can it change the brain, right? If somebody is telling you that this is transcranial stimulation, can it change the brain, right? Stimulating or putting a magnet in your brain, can it change the brain? Is it helping your patient to learn, right? Or is just a transitory change in your brain which may or may not happen, all sorts of things, right? So if you are looking into any treatment technique, and if they are keeping on saying that it is stimulating this and stimulating that, changing your CSF as claimed by craniosacral therapists, uh, the most funniest people of all, can it can it lead to any learning in your patient? Does it change your brain, right? If the answer is no, kick the treatment technique. You don't have to do anything else. That is the simplest way for screening for any new treatment technique in neurology, right? If it is not helping you in doing movements by the patient, by themselves, that is actively and helping in learning, that treatment technique is basically useless, right? So that is the first level of screening in neurorehabilitation. The next level is seeing whether it is biologically plausible. The last one is whether they are actually effective, right, when you are putting it on patients, right? So those are the next two levels we will see in subsequent videos. Thank you for watching our video. Please don't forget to subscribe to our channel. Thank you.